The call to action is released by the UN organization to ask for greater attention and greater investment to address the dramatic crisis of malnutrition which we are seeing as a result of combination of climate shocks, conflicts, economic downturns, and COVID-19, which have increased the number of malnourished children. We now have, more than 30 million children who are malnourished, and some of them, at least 8 million, are severely affected, and that increases their risk of death up to 12 times compared to the children who are well nourished. WHO is trying to increase the access to the necessary treatment for the malnourished children, and that means increasing the number, which is now only 2 out of 10 children who receive the adequate treatment. We have been updating the science and the recommendations about how to manage severe acute malnutrition. We've been providing tools, we've been providing training to health workers and helping the countries with the highest burden who are worst affected to develop scale-up plans. We've also been trying to curb the drift towards increased malnutrition by promoting and supporting adequate nutrition in the first months of life, particularly breastfeeding, but then also adequate complementary feeding. And this is together all the work to make the environment where children live less prone to infections, which is another cause of malnutrition. So with better water and better sanitation, and above all, better access to health care, universal health coverage for primary care services to all children. The governments of the countries that are worst affected can mainstream the management of acute malnutrition in their health services, but they can also have adequate social protection programs for the families of these vulnerable children. They can strengthen food security. They can make the access to safe water and sanitation accessible to all. And the donor countries can scale up and focus their resources to the countries and to the services to address severe acute malnutrition.